Here we're at the Pleasant Prairie DE-MSN Marquette site. You can expect to be greeted with a smile by the coordinator at the desk. You have your faculty here to encourage you, to uplift you, and to answer every question you might need. There's rooms for students to hang out in, or there's study rooms where you can hang out and study and learn pharmacology or whatnot.
This new site is incredible because one, it's bigger. We have the capability to double the amount of students that we can help to learn at one given time. We have 4 simulation labs that the students can go in and practice on different types of patients, whether it's an adult or a child or a neonate. We also have a huge skills lab. It gives them the opportunity to really practice more in such a big space. The new simulation mannequins are incredible. We have a neonate that actually can do retractions. We can assess pupils and actually see the reaction to pupils with a pen light on a doll.
Some opportunities that this new site will bring will be able to have them practice their nursing skills like critical thinking, therapeutic communication, and preparing them for real-world situations. You came across this video for a reason. You're here because you have a fire to help save people, to help heal people. I would say commit, take a leap of faith. There will be growing pains, but it's for you to grow, and you will never regret becoming a nurse.
Marquette University's Direct Entry MSN program gives you the flexibility to choose your preferred learning format and program timeline. Have the choice between a 5 or 8 semester program duration and complete your coursework predominantly in person or online. Experience hands-on learning in simulation labs and benefit from clinical rotations with Marquette's top healthcare partners. With multiple program formats for you to choose from, you can earn your MSN without putting your life on hold. Learn more today.
I had a family member who was very ill. Thank goodness for the nurses. They really inspired me to want to pursue the same career. I chose Marquette University because of the rankings online. People who have families or they have children, they can definitely do this program. Whenever I go out to a hospital, people recognize Marquette University.
I want to be a nurse because I want to help people. I want to save some lives. And I can get my master's in nursing so fast and not have to worry about coming from a gerontology background. Marquette is the place I chose because it was 21 months accelerated. What's better than that, right? Just taking care of patients is just what I want to do.
I decided to become a nurse because I wanted to directly leave an impact on people. I chose Marquette University because the faculty and the academic advisors completely drew me in, and they were there for me at all times. I want to connect with my patients that I help and show them that there's a person there for them and connect and build a bond with them.
The Direct Entry Master of Science in Nursing program from Marquette University lets you build on your non-nursing bachelor's degree to earn your MSN in 21 months or less. You can train to be a Marquette nurse focused on excellence, compassion, and leadership, and grounded in Jesuit principles. Choose the coursework format that suits your learning style, campus-based or hybrid online, and gain hands-on experience in simulation labs and clinical rotations with top healthcare facilities. You'll start with state-of-the-art coursework, then put your new knowledge and skills to work in mixed reality environments and lifelike scenarios in our high-fidelity simulation center. Choose the in-person program at our historic Milwaukee campus, or the hybrid online option based at our new state-of-the-art learning site in Pleasant Prairie. Marquette University's Direct Entry MSN is your path to a career that changes lives. Search Marquette DE-MSN today.
Here we're at the Pleasant Prairie DE-MSN Marquette site. You can expect to be greeted with a smile by the coordinator at the desk. You have your faculty here to encourage you, to uplift you, and to answer every question you might need. There's rooms for students to hang out in, or there's study rooms where you can hang out and study and learn pharmacology or whatnot.
This new site is incredible because one, it's bigger. We have the capability to double the amount of students that we can help to learn at one given time. We have 4 simulation labs that the students can go in and practice on different types of patients, whether it's an adult or a child or a neonate. We also have a huge skills lab. It gives them the opportunity to really practice more in such a big space. The new simulation mannequins are incredible. We have a neonate that actually can do retractions. We can assess pupils and actually see the reaction to pupils with a pen light on a doll.
Some opportunities that this new site will bring will be able to have them practice their nursing skills like critical thinking, therapeutic communication, and preparing them for real-world situations. You came across this video for a reason. You're here because you have a fire to help save people, to help heal people. I would say commit, take a leap of faith. There will be growing pains, but it's for you to grow, and you will never regret becoming a nurse.
Marquette University's direct entry MSN program gives you the flexibility to choose your preferred learning format and program timeline. Have the choice between a 5 or 8 semester program duration and complete your coursework predominantly in person or online. Experience hands-on learning in simulation labs and benefit from clinical rotations with Marquette's top healthcare partners. With multiple program formats for you to choose from, you can earn your MSN without putting your life on hold. Learn more today.
I had a family member who was very ill. Thank goodness for the nurses. They really inspired me to want to pursue the same career. I chose Marquette University because of the rankings online. People who have families or they have children, they can definitely do this program. Whenever I go out to the hospital, people recognize Marquette University.
I want to be a nurse because I want to help people. I want to save some lives. And I can get my master's in nursing so fast and not have to worry about coming from a gerontology background. Marquette is the place I chose because it was 21 months accelerated. What's better than that, right? Just taking care of patients is just what I want to do.
I decided to become a nurse because I wanted to directly leave an impact on people. I chose Marquette University because the faculty and the academic advisors completely drew me in, and they were there for me at all times. I want to connect with my patients that I help and show them that there's a person there for them and connect and build a bond with them.
The direct entry Master of Science in Nursing program from Marquette University lets you build on your non-nursing bachelor's degree to earn your MSN in 21 months or less. You can train to be a Marquette nurse focused on excellence, compassion, and leadership, and grounded in Jesuit principles. Choose the coursework format that suits your learning style, campus-based or hybrid online, and gain hands-on experience in simulation labs and clinical rotations with top healthcare facilities. You'll start with state-of-the-art coursework, then put your new knowledge and skills to work in mixed reality environments and lifelike scenarios in our high-fidelity simulation center. Choose the in-person program at our historic Milwaukee campus, or the hybrid online option based at our new state-of-the-art learning site in Pleasant Prairie. Marquette University's direct entry MSN is your path to a career that changes lives. Search Marquette DE MSN today.
Here we're at the Pleasant Prairie DE MSN Marquette site. You can expect to be greeted with a smile by the coordinator at the desk. You have your faculty here to encourage you, to uplift you, and to answer every question you might need. There's rooms for students to hang out in, or there's study rooms where you can hang out and study and learn pharmacology or whatnot.
This new site is incredible because one, it's bigger. We have the capability to double the amount of students that we can help to learn at one given time. We have 4 simulation labs that the students can go in and practice on different types of patients, whether it's an adult or a child or a neonate. We also have a huge skills lab. It gives them the opportunity to really practice more in such a big space. The new simulation mannequins are incredible. We have a neonate that actually can do retractions. We can assess pupils and actually see the reaction to pupils with a pen light on a doll.
Some opportunities that this new site will bring will be able to have them practice their nursing skills like critical thinking, therapeutic communication, and preparing them for real-world situations. You came across this video for a reason. You're here because you have a fire to help save people, to help heal people. I would say commit, take a leap of faith. There will be growing pains, but it's for you to grow, and you will never regret becoming a nurse.
Marquette University's direct entry MSN program gives you the flexibility to choose your preferred learning format and program timeline. Have the choice between a 5 or 8 semester program duration and complete your coursework predominantly in person or online. Experience hands-on learning in simulation labs and benefit from clinical rotations with Marquette's top healthcare partners. With multiple program formats for you to choose from, you can earn your MSN without putting your life on hold. Learn more today.
I had a family member who was very ill. Thank goodness for the nurses. They really inspired me to want to pursue the same career. I chose Marquette University because of their rankings online. People who have families or they have children, they can definitely do this program. Whenever I go out to a hospital, people recognize Marquette University.
I want to be a nurse because I want to help people. I want to save some lives. And I can get my master's in nursing so fast and not have to worry about coming from a gerontology background. Marquette is the place I chose because it was 21 months accelerated. What's better than that, right? Just taking care of patients is just what I want to do.
I decided to become a nurse because I wanted to directly leave an impact on people. I chose Marquette University because the faculty and the academic advisors completely drew me in, and they were there for me at all times. I want to connect with my patients that I help and show them that there's a person there for them and connect and build a bond with them.
The direct entry Master of Science in Nursing program from Marquette University lets you build on your non-nursing bachelor's degree to earn your MSN in 21 months or less. You can train to be a Marquette nurse focused on excellence, compassion, and leadership, and grounded in Jesuit principles. Use the coursework format that suits your learning style, campus-based or hybrid online, and gain hands-on experience in simulation labs and clinical rotations with top healthcare facilities. You'll start with state-of-the-art coursework, then put your new knowledge and skills to work in mixed reality environments and lifelike scenarios in our high-fidelity simulation center. Choose the in-person program at our historic Milwaukee campus or the hybrid online option based at our new state-of-the-art learning site in Pleasant Prairie. Marquette University's direct entry MSN is your path to a career that changes lives. Search Marquette DE MSN today.
Here we're at the Pleasant Prairie DE MSN Marquette site. You can expect to be greeted with a smile by the coordinator at the desk. You have your faculty here to encourage you, to uplift you, and to answer every question you might need. There's rooms for students to hang out in, or there's study rooms where you can hang out and study and learn pharmacology or whatnot.
This new site is incredible because one, it's bigger. We have the capability to double the amount of students that we can help to learn at one given time. We have 4 simulation labs that the students can go in and practice on different types of patients, whether it's an adult or a child or a neonate. We also have a huge skills lab. It gives them the opportunity to really practice more in such a big space. The new simulation mannequins are incredible. We have a neonate that actually can do retractions. We can assess pupils and actually see the reaction to pupils with a pen light on a doll.
Some opportunities that this new site will bring will be able to have them practice their nursing skills like critical thinking, therapeutic communication, and preparing them for real-world situations. You came across this video for a reason. You're here because you have a fire to help save people, to help heal people. I would say commit, take a leap of faith. There will be growing pains, but it's for you to grow, and you will never regret becoming a nurse.
Marquette University's direct entry MSN program gives you the flexibility to choose your preferred learning format and program timeline. Have the choice between a 5 or 8 semester program duration and complete your coursework predominantly in person or online. Experience hands-on learning in simulation labs and benefit from clinical rotations with Marquette's top healthcare partners. With multiple program formats for you to choose from, you can earn your MSN without putting your life on hold. Learn more today.
I had a family member who was very ill. Thank goodness for the nurses. They really inspired me to want to pursue the same career. I chose Marquette University because of their rankings online. People who have families or they have children, they can definitely do this program. Whenever I go out to a hospital, people recognize Marquette University.
I want to be a nurse because I want to help people. I want to save some lives. And I can get my master's in nursing so fast and not have to worry about coming from a gerontology background. Marquette is the place I chose because it was 21 months accelerated. What's better than that, right? Just taking care of patients is just what I want to do.
I decided to become a nurse because I wanted to directly leave an impact on people. I chose Marquette University because the faculty and the academic advisors completely drew me in, and they were there for me at all times. I want to connect with my patients that I help and show them that there's a person there for them and connect and build a bond with them.
The direct entry Master of Science in Nursing program from Marquette University lets you build on your non-nursing bachelor's degree to earn your MSN in 21 months or less. You can train to be a Marquette nurse focused on excellence, compassion, and leadership, and grounded in Jesuit principles. Choose the coursework format that suits your learning style, campus-based or hybrid online, and gain hands-on experience in simulation labs and clinical rotations with top healthcare facilities. You'll start with state-of-the-art coursework, then put your new knowledge and skills to work in mixed reality environments and lifelike scenarios in our high-fidelity simulation center. Choose the in-person program at our historic Milwaukee campus or the hybrid online option based at our new state-of-the-art learning site in Pleasant Prairie. Marquette University's direct entry MSN is your path to a career that changes lives. Search Marquette DE MSN today.
Here we're at the Pleasant Prairie DE MSN Marquette site. You can expect to be greeted with a smile by the coordinator at the desk. You have your faculty here to encourage you, to uplift you, and to answer every question you might need. There's rooms for students to hang out in, or there's study rooms where you can hang out and study and learn pharmacology or whatnot.
This new site is incredible because one, it's bigger. We have the capability to double the amount of students that we can help to learn at one given time. We have 4 simulation labs that the students can go in and practice on different types of patients, whether it's an adult or a child or a neonate. We also have a huge skills lab. It gives them the opportunity to really practice more in such a big space. The new simulation mannequins are incredible. We have a neonate that actually can do retractions. We can assess pupils and actually see the reaction to pupils with a pen light on a doll.
Some opportunities that this new site will bring will be able to have them practice their nursing skills like critical thinking, therapeutic communication, and preparing them for real-world situations. You came across this video for a reason. You're here because you have a fire to help save people, to help heal people. I would say commit, take a leap of faith. There will be growing pains, but it's for you to grow, and you will never regret becoming a nurse.
Marquette University's direct entry MSN program gives you the flexibility to choose your preferred learning format and program timeline. Have the choice between a 5 or 8 semester program duration and complete your coursework predominantly in person or online. Experience hands-on learning in simulation labs and benefit from clinical rotations with Marquette's top healthcare partners. With multiple program formats for you to choose from, you can earn your MSN without putting your life on hold. Learn more today.
I had a family member who was very ill. Thank goodness for the nurses. They really inspired me to want to pursue the same career. I chose Marquette University because of the rankings online. People who have families or they have children, they can definitely do this program. Whenever I go out to a hospital, people recognize Marquette University.
I want to be a nurse because I want to help people. I want to save some lives. And I can get my master's in nursing so fast and not have to worry about coming from a gerontology background. Marquette is the place I chose because it was 21 months accelerated. What's better than that, right? Just taking care of patients is just what I want to do.
I decided to become a nurse because I wanted to directly leave an impact on people. I chose Marquette University because the faculty and the academic advisors completely drew me in, and they were there for me at all times. I want to connect with my patients that I help and show them that there's a person there for them and connect and build a bond with them.
The direct entry Master of Science in Nursing program from Marquette University lets you build on your non-nursing bachelor's degree to earn your MSN in 21 months or less. You can train to be a Marquette nurse focused on excellence, compassion, and leadership, and grounded in Jesuit principles. Choose the coursework format that suits your learning style, campus-based or hybrid online, and gain hands-on experience in simulation labs and clinical rotations with top healthcare facilities. You'll start with state-of-the-art coursework, then put your new knowledge and skills to work in mixed reality environments and lifelike scenarios in our high-fidelity simulation center. Choose the in-person program at our historic Milwaukee campus or the hybrid online option based at our new state-of-the-art learning site in Pleasant Prairie. Marquette University's direct entry MSN is your path to a career that changes lives. Search Marquette DE MSN today.
Here we're at the Pleasant Prairie DE MSN Marquette site. You can expect to be greeted with a smile by the coordinator at the desk. You have your faculty here to encourage you, to uplift you, and to answer every question you might need.
There's rooms for students to hang out in, or there's study rooms where you can hang out and study and learn pharmacology or whatnot.
This new site is incredible because one, it's bigger. We have the capability to double the amount of students that we can help to learn at one given time. We have 4 simulation labs that the students can go in and practice on different types of patients, whether it's an adult or a child or a neonate. We also have a huge skills lab. It gives them the opportunity to really practice more in such a big space. The new simulation mannequins are incredible. We have a neonate that actually can do retractions. We can assess pupils and actually see the reaction to pupils with a pen light on a doll.
Some opportunities that this new site will bring will be able to have them practice their nursing skills like critical thinking, therapeutic communication, and preparing them for real-world situations. You came across this video for a reason. You're here because you have a fire to help save people, to help heal people. I would say commit, take a leap of faith. There will be growing pains, but it's for you to grow, and you will never regret becoming a nurse.
Marquette University's direct entry MSN program gives you the flexibility to choose your preferred learning format and program timeline. Have the choice between a 5 or 8 semester program duration and complete your coursework predominantly in person or online. Experience hands-on learning in simulation labs and benefit from clinical rotations with Marquette's top healthcare partners. With multiple program formats for you to choose from, you can earn your MSN without putting your life on hold. Learn more today.
I had a family member who was very ill. Thank goodness for the nurses. They really inspired me to want to pursue the same career. I chose Marquette University because of the rankings online. People who have families or they have children, they can definitely do this program. Whenever I go out to a hospital, people recognize Marquette University.
I want to be a nurse because I want to help people. I want to save some lives. And I can get my master's in nursing so fast and not have to worry about coming from a gerontology background. Marquette is the place I chose because it was 21 months accelerated. What's better than that, right? Just taking care of patients is just what I want to do.
I decided to become a nurse because I wanted to directly leave an impact on people. I chose Marquette University because the faculty and the academic advisors completely drew me in, and they were there for me at all times. I want to connect with my patients that I help and show them that there's a person there for them and connect and build a bond with them.
The direct entry Master of Science in Nursing program from Marquette University lets you build on your non-nursing bachelor's degree to earn your MSN in 21 months or less. You can train to be a Marquette nurse focused on excellence, compassion, and leadership, and grounded in Jesuit principles. Choose the coursework format that suits your learning style, campus-based or hybrid online, and gain hands-on experience in simulation labs and clinical rotations with top healthcare facilities. You'll start with state-of-the-art coursework, then put your new knowledge and skills to work in mixed reality environments and lifelike scenarios in our high-fidelity simulation center. Choose the in-person program at our historic Milwaukee campus or the hybrid online option based at our new state-of-the-art learning site in Pleasant Prairie. Marquette University University's direct entry MSN is your path to a career that changes lives. Search Marquette DE MSN today.
Here we're at the Pleasant Prairie DE MSN Marquette site. You can expect to be greeted with a smile by the coordinator at the desk. You have your faculty here to encourage you, to uplift you, and to answer every question you might need.
There's rooms for students to hang out in, or there's study rooms where you can hang out and study and learn pharmacology or whatnot.
This new site is incredible because one, it's bigger. We have the capability to double the amount of students that we can help to learn at one given time. We have 4 simulation labs that the students can go in and practice on different types of patients, whether it's an adult or a child or a neonate. We also have a huge skills lab. It gives them the opportunity to really practice more in such a big space. The new simulation mannequins are incredible. We have a neonate that actually can do retractions. We can assess pupils and actually see the reaction to pupils with a pen light on a doll.
Some opportunities that this new site will bring will be able to have them practice their nursing skills like critical thinking, therapeutic communication, and preparing them for real-world situations. You came across this video for a reason. You're here because you have a fire to help save people, to help heal people. I would say commit, take a leap of faith. There will be growing pains, but it's for you to grow, and you will never regret becoming a nurse.
Marquette University's direct entry MSN program gives you the flexibility to choose your preferred learning format and program timeline. Have the choice between a 5 or 8 semester program duration and complete your coursework predominantly in person or online. Experience hands-on learning in simulation labs and benefit from clinical rotations with Marquette's top healthcare partners. With multiple program formats for you to choose from, you can earn your MSN without putting your life on hold. Learn more today.
I had a family member who was very ill. Thank goodness for the nurses. They really inspired me to want to pursue the same career. I chose Marquette University because of the rankings online. People who have families or they have children, they can definitely do this program. Whenever I go out to a hospital, people recognize Marquette University.
I want to be a nurse because I want to help people. I want to save some lives. And I can get my master's in nursing so fast and not have to worry about coming from a gerontology background. Marquette is the place I chose because it was 21 months accelerated. What's better than that, right? Just taking care of patients is just what I want to do.
I decided to become a nurse because I wanted to directly leave an impact on people. I chose Marquette University because the faculty and the academic advisors completely drew me in, and they were there for me at all times. I want to connect with my patients that I help and show them that there's a person there for them and connect and build a bond with them.
The direct entry Master of Science in Nursing program from Marquette University lets you build on your non-nursing bachelor's degree to earn your MSN in 21 months or less. You can train to be a Marquette nurse focused on excellence, compassion, and leadership, and grounded in Jesuit principles. Choose the coursework format that suits your learning style, campus-based or hybrid online, and gain hands-on experience in simulation labs and clinical rotations with top healthcare facilities. You'll start with state-of-the-art coursework, then put your new knowledge and skills to work in mixed reality environments and lifelike scenarios in our high-fidelity simulation center. Choose the in-person program at our historic Milwaukee campus or the hybrid online option based at our new state-of-the-art learning site in Pleasant Prairie. Marquette University's direct entry MSN is your path to a career that changes lives. Search Marquette DE MSN today.
Well, hello, everyone. Thank you for joining us today for our Open House Pathways to Nursing event. My name is Torin Grogan. I'll be the host of this evening. I'm the admissions manager for the Direct Entry MSN program here at Marquette University, and I'm also the site director for our Pleasant Prairie location, so that's where we are here today. So thank you all for attending us in person, taking time out of your day. We really appreciate it. And thank you all who are joining us on YouTube. Shout out to all of you guys joining us live. If you guys can all just please enter your first name, last initial, just so we can take attendance. Again, thank you guys so much for joining us. So what we have on the agenda for today, we'll go through some program overview, some program information. We'll do some staff introductions. We have an amazing nursing panel here today. We'll do a Q&A session and talk about next steps if anyone wants to do next steps. So program overview, just a very basic level overview, right? So we're the Direct Entry MSN program, right? So that master level nursing program. And our program's broken down into 3 key components, right? So the first component is going to be your coursework. The second component is going to be your labs, including skills and simulation. And then your third component is going to be your clinical rotations, right? So when it comes to the nursing coursework, right, we have 2 different programs. We have one program that's a hybrid modality that has like didactic, online, asynchronous coursework. And then we have another program that's our all in-person, traditional lecture-based coursework, right? So when deciding which program is best for you, you have to think about what's your learning preference, right? Do you prefer to have in-person lectures going in almost every single day for lectures? Or would you kind of rather have that hybrid modality, that flexibility, kind of self-paced nature? It follows like a module-based learning style, right? So week 1 is module 1, week 2 is module 2. You always know your assignments, your due dates, and you kind of get to work at your own self-pace, right? So it's really just your learning preference, right? And for the hybrid program, that's located at our Pleasant Prairie location. So we have a fall and spring start. That's our 5-semester option. And we just launched a brand new summer start. That's an 8-semester option that's kind of extended. So it's for students who want to do the program at like a more longer pace, right? Kind of a slower pace. So instead of 5 classes per semester, you'll do 3 classes per semester, but you're still considered a full-time student. And then whereas the in-person program, that's located in Milwaukee, and that is only for summer. And it's only a 5-semester option. And then your labs, right? So for your labs, you'll do your first semester, you'll start skills lab. Second semester, you'll start simulation. So skills lab, that's where you learn all the hands-on skills to be a nurse, like hand washing, bedside manners, IV injections, catheter suturing, the whole 9. And then in in simulation, second semester, that's where you get to practice those skills, right? You get to make your mistakes, do it in that safe environment with your peers, with your professors, and all that kind of stuff. And then your clinical rotation component. Any questions so far? And then we'll get into clinicals. We have our amazing clinical expert here, so we'll get into all the clinical information. But just to highlight the admissions requirements real quick. So we require a non-nursing bachelor degree, cumulative GPA 3.0 or higher, and we require 7 prerequisites. So we require 5 to 6 credits of anatomy and physiology, 3 credits of microbiology with a lab. That's the only course we require a lab. And then 3 credits of a chemistry, biology, or a biochemistry course, 3 credits of nutrition, 3 credits of a statistics, 3 credits of a social science. Now I'm going to take a sip of water. But yeah, we make the admissions process super easy for everyone. All you do is you inquire to the program, right? You speak to an advisor. We review your transcripts. If you're missing anything, we come up with an academic plan. We have an amazing scholarship offering for prerequisites. So prerequisites, we offer $95 per credit. So if you're missing a prerequisite course, we'll help you take that course. We'll help you work on the application. You'll complete the application, and you will get reviewed. Oops, this is not supposed to play. And so what's the application entail? You just kind of submit your education background, your work experience. You'll submit your unofficial academic transcripts, 3 letters of recommendation, an updated resume, and a personal statement. You'll answer like 3 essay questions, basically. Very easy, and again, we help you through that. We walk you through it. But why come to MU for nursing, right? Why come to Marquette for nursing? The Marquette nurse, and I'll let kind of the program director talk about that. The Marquette nurse is a very type of special nurse, right? We hold that very dear to us. We have amazing, passionate, and supportive faculty here. We have one amazing faculty member here who does teach in the program, and also is an alumni, which is awesome. Shout out to Haley. Our amazing clinical partners, again, we partner with the best clinicals in the surrounding area, and I'll let Dr. Brenda Kutzke talk about that. Our diverse student body. We have an amazing diverse student body, and again, these student ambassadors will be able to talk about that. And we have a very strong NCLEX pass rate. So our NCLEX pass rate for first-time test takers was 93.86 in 2024. I mean, that's pretty freaking good. I don't know how you can get better than that. And then also academic support. So our academic advisor could not be here today. It was her birthday. Shout out to you, Delara. Happy birthday. But you will get a lot of support throughout the program, right? So you'll do a pre-start call with her before you start the program, go over any information you want to go over. She'll give you ongoing support throughout the program. She'll assist you with registration, be an emotional support person for you, right? The program can be difficult. She'll be right there with you. We also offer tutoring services, so you'll get like a lot of support throughout the program. Any questions so far? Okay. Again, that's very high level stuff, but with the real questions you're going to want to ask these people, right? This is the juice, the nursing panel, right? And before that, I just want to thank a couple people. First, I want to thank the marketing team for being here. They're the ones who set this all up, so shout out to you guys from marketing. I also want to thank Deb Downer. She's the one who helps me plan all these events. She's amazing. I want to thank Ryan Erickson, admissions advisor. He's here to help support it. Alicia Hurd, office manager. She's amazing. And then Matt, our sim guy. He's awesome. You'll get to know him a lot throughout the program. He's a goof. But yeah, so that's enough about that. The next topic I do want to talk about real quick is, I want to introduce first and foremost our amazing program director, Professor Holly Neroni. You want to say a couple words?
Is this working? Hello? I'm not sure. Are we muted? It's working? Okay. Hi. Welcome. Glad to see everybody here. I'll be talking a little bit later about Marquette nursing characteristics and some elements of the program, so not really much to say. Just I'm Holly, and I'm happy to be here. I've been here about 2 years with Marquette, been the program director the entire time, and it's been amazing to see all the students come through this program. So.
Awesome. Thank you, Holly. And then this next person, we like to call her Queen Bee around the site. She's the OG. She's been here from the very beginning, our very first cohort. She does a little bit of this. She does a little bit of that. But most importantly, she does clinicals, right? So I want to introduce Dr. Brenda Kutsky, and so she can give some insight into clinicals.
Okay. Thank you, Torin. I appreciate that. So yes, I have been here with Marquette since this program started here in Pleasant Prairie in 2016. So I believe we have now started our 20th cohort.
20th is in spring.
In spring. Oh gosh, yes. So time flies. So with that, we've had great growth with our program. Our first cohort started with 13 students. And here we are now accepting anywhere between 72 and 96 twice a year. And then our summer start, some new and exciting things that keep happening with our program. So my main role is to help support all of the students when it comes to logistics, clinical placements, and then operations here. So all of your scheduling. So getting you all to clinical every semester, making sure that your schedules are open for testing. We do most of your testing here in person in Pleasant Prairie, and we're actually sitting here in a testing room right now. So we supply you those computers and make sure that you have what you need, kind of take away that stress. You don't have to worry about your own laptop having the latest update, or do you have a Mac or a PC, or what do you have? So we make sure that that's all in working order for you when you come here to test. Our job is to support you to be successful. And our retention rate when it comes to students and providing support is, what is it? 90?
Well into the 90s.
Yeah,
96
96%. So,
depending on the year.
yeah. So retention rate. So, the faculty and the staff here are here to make sure that you are successful and that you do finish this program. So with that, clinicals are my main focus. I live and breathe them. So we do clinicals in Illinois and then also Wisconsin. Obviously, we are right on the border between the two states. And we are approved to have clinicals in both states, which is a great thing. So we do have clinicals all the way from northern Chicago all the way up into Milwaukee. I like to brag a little bit. We did have clinicals all the way through COVID. So, and I can say we are probably one of the only nursing programs in Wisconsin that was able to offer that. And so all of our students went to the hospitals during COVID. So that talks a little bit about our relationships that we do have with our clinical partners. I know Holly is going to talk about the Marquette nurse, but we take pride in that and take pride in our relationships and the experiences that we provide students. While the main focus of NCLEX and our clinicals is general medical surgical nursing, we do, again, have coursework that is in pediatrics and OB, mental health, and we do try to provide those type of experiences when it does come to clinical. So, and again, we have great relationships with some of those specialty hospitals, Children's Hospital of Wisconsin, Aurora Psychiatric Hospital. We are in different ICUs and emergency rooms. Different, the Freighter Memorial Hospital in Milwaukee, level 1 trauma. Condell Hospital, that is a level 2 trauma, I believe. Is it level 1? Yep. So level 1 in Illinois. So again, those experiences that we provide are just awesome. And we, I can't say enough about that. And I'm sure that our ambassadors will talk a little bit more about their clinical experiences. And so you'll be able to ask them questions too. What else can I tell you? Simulation, I help also schedule that. So in your second, third, and fourth semesters, you do come here to the campus, and those of you that are here got to experience and see what our simulation lab is like. And again, we have the top of the line mannequins and resources that are available for those simulation experiences. So that's your concentration on the second, third, and fourth semesters. So you will come here, I would say about, what do you think? 8 times a semester. Again, if you do come here to Pleasant Prairie, you do come here for simulation for 4-hour blocks. In Milwaukee, in the Milwaukee program, you do go there for 2-hour blocks. So there is a little bit of difference when it comes to that piece of it. But the simulation, the curriculum, the experiences are all the same when it comes to that. It is one program, just 2 different locations, 2 different modalities that are the focus. What else? What else can I tell you? Yes. Sounds good. Yep. Yes, I'm going to pass this off to Haley Crabtree. So,
hi. Is this working still? Yeah. Hi, I'm Haley Crabtree. I was a student in this program, so I was them one day years ago. I was in the program during COVID, so I can attest to that. I was there. I experienced it. Yeah. What drew me to this program specifically was getting that master's degree, I think, specifically, rather than a bachelor's degree. But now that I'm here, I'm teaching here, and I'm teaching in that very first semester. The 6013 is the lab class. That's where I'm teaching like the hands-on skills, how to place an IV, an NG tube, how to assess a patient. And I'm also teaching at clinical sites in Illinois. I live in Illinois, so I teach at the sites in Illinois. Specifically Advocate, Good Shepherd, Lutheran General, and Condell. So I've taught at all 3 of those hospitals so far. I love it. I love teaching. Yeah. What else can I say?
Hey, yeah, thank you, Haley. We'll do the full thing all over again. Well, thank you everyone for introducing yourselves. So we're gonna jump back to the program director, Holly Neroni. So Holly, can you just talk us through a little bit about what the Marquette nurse means? We love the Marquette nurse. The hospitals love the Marquette nurse. Everyone loves the Marquette nurse. Tell us.
Yeah, so at Marquette, we pride ourselves in developing our nurses with 5 key characteristics in mind. And so I'll just go through those briefly. Cura personalis is the first one we touch on, and that really means care for the whole person. And that is an Ignatian tenet, I suppose. So Marquette University itself embraces cura personalis. And so in the nursing context, we really talk about it that patients aren't just a collection of body parts that might be broken and need to be repaired. They have spiritual sides, they have mental health needs, they have socioeconomic backgrounds and other things that need to be paid attention to. And so we really embrace that holistic care outlook. And that also is something that we do amongst ourselves. So between faculty and students, and faculty and our faculty colleagues and staff and so forth. So Cura Personalis is really the cornerstone of the way we approach our educational programs. So a couple of more, advocates for the vulnerable. Nurses are in a position of taking care of people at their most vulnerable moments. So even if you're a nurse taking care of a patient in a clinic who's coming in for a well check, you have access to their personal private information. You have conversations about that are, you have to be careful with and respect their privacy. You have to embrace non-judgmental acceptance. They are vulnerable. You are in a position of power over them. So you are also in a position to advocate for them to ensure that they have equitable access to care, which feeds into being social justice champions. That's another one of our Marquette nurse characteristics. And so those two go very much hand in hand. Engaged critical thinkers is another Marquette nurse characteristic. And so I talk about this as not just learning to recall information, the complex medical information that you're learning, but being able to assess a patient, see what's going on, and quickly come to a clinical judgment about what your next move is going to be. Critical thinking is the cornerstone of any good nurse and what they do every day. So very important. And then courageous leaders is the fifth one. So now more than ever before, nurses need to be courageous and need to take positions of leadership throughout healthcare. So we outnumber physicians and providers by more than 4 to 1 in this country. So we are absolutely the largest segment of the healthcare workforce. And it's important that nurses use that to propel healthcare forward. We got a lot of work to do in this country. So those are the Marquette nurse characteristics. So Cura Personalis, advocates for the vulnerable, social justice champions, engaged critical thinkers, and courageous leaders.
Awesome. Thank you, Holly. And now we will start the panel, right? And so since we already have the mic, Holly, we're just going to kind of start it and go down this line. So Holly, why don't you just tell us about your specific pathway to nursing, and everyone kind of gets 3 to 4 minutes apiece. Then we'll open it up for a Q&A session.
Huh? We'll see about that.
Yeah, no. If you need 6, 7, go take it. We're ahead of schedule.
No,
So
I don't necessarily like to talk.
We're
I'd
ahead
rather
of
listen,
schedule.
and everybody else is much more interesting than me. Okay, so one day, long ago. No, I'm kidding. So I really started my journey to nursing after having multiple different careers in my life. I was a single parent for a little while, got remarried, and my husband was like, you always talked about going back to school and becoming a nurse. And so I did just that. I took a job as a CNA while I was going through my undergrad. I enrolled in an associate degree program, so I laddered. I did my ADN, BSN completion, then my MSN, and now I am finishing dissertation for my PhD. So been in school a really long time, but love learning. So in my ADN program, I had to become a CNA in order to participate in clinicals. So I worked as an obstetrics technician. So that's a surgical technician. Predominantly what I did is I was in the OR helping deliver babies by C-sections and doing all sorts of women's health surgeries. Had a real passion for women's health coming out of that. So when I passed NCLEX and got my RN license, I looked for something in labor and delivery. Nothing was available. So I started as an OR circulator at the Wisconsin Heart Hospital. And so I will tell you, the privilege of seeing an open beating heart in my first cardiothoracic surgery was phenomenal. And I couldn't even believe they were letting me run these high-tech machines in circulating cases like that. It was just an awesome experience. But eventually I'm like, I really want to get back to a place where I can take care of moms and babies. So transferred to a hospital that I knew had a labor and delivery unit, did cardiopulmonary thoracic stroke, so intermediate care, stepped down from the ICU, really firmed up my foundational skills in that setting because the OR is such a unique, specific experience in nursing that I had kind of felt like, gosh, when was the last time I did a head-to-toe assessment on a patient? So in the CPT unit, really got all of that firmed up. And then as soon as there was an opening on the L&D unit, one floor up, I was able to transfer and do labor and delivery, which really was where I had hoped to be all along. Started teaching while I was continuing in school. So after I did my ADN, I turned right around, immediately enrolled in my BSN completion. I knew I wanted to go on to grad school, and there wasn't really an ADN to MSN that I could find at the time. So did my BSN completion, turned right around, enrolled in an MSN. Right after that, enrolled in my PhD, and have been in school ever since. Little interruption with the PhD with COVID, transferred eventually to Marquette, so I'm finishing it here at Marquette. PhD candidate, I just have to finish writing chapters 4 and 5 and all that jazz, but close. My doctorate is actually in educational policy and leadership. After 3 nursing degrees, I'm like, I think I'll do leadership and educational leadership for the doctorate level. So my primary specialization really is nursing education. I am a certified nurse educator, and so I share that because nursing will give you so many opportunities you'll never get bored. I've had 3 different clinical specialties with OR, cardiac, or CPT, and then labor and delivery, and then now nursing education. And so if you don't like something you're doing, you can find another pathway. It's just the world is your oyster when you are a nurse. You have so many opportunities to serve. So I think that's it.
Thank you. You did good on
Did
time.
you time me?
No, I did. You did really good.
Really? All right.
Good for
See?
you.
Okay.
Wow.
Just for you, Torin. Okay.
Wow, that was amazing. Thank you, Holly Neroni. All right, Dr. Brenda Cutsey, Queen Bee.
Okay, I'm back. Back to me. So again, I've been through a lot when it comes to nursing. My educational background is a little bit different. Kind of the exact opposite. I went to nursing school. Well, I went to a 4-year college right after I graduated from high school. Did not know that I wanted to go into nursing, but I knew that I wanted to get out of my parents' house. So when I got to college, that's where I kind of discovered that caregiving was the way that I wanted to go. Kind of led me to a 6-year bachelor's degree. It did take me a little bit longer. But with that, I did get my BSN. My MSN came 10 years later. So I did not go from program to program. I was young, 23 years old as a new grad, but and I'll talk about my nursing experiences. But then another 10 years after I received my MSN, I did go back for my DNP. I do say that I was bamboozled by some friends each time I went back to class because I said I was never going back to school again. So I can sympathize, and I understand the dedication and the work and what it takes to come back to school as that next degree. But know that your faculty and the people that are around you do understand that. It is a lot, and it is dedicating yourself to that. And I've been through that. But the rewards are just amazing. So when it comes to my nursing career, I have done everything from soup to nuts, basically. Started out in bone marrow oncology, went to home care nursing, went to ambulatory care, was a supervisor, worked at the VA hospital in Milwaukee with geriatric population. Again, one of my first loves. While I was at the VA hospital, I was able to, I was going back for my master's degree, got to spend time with the CNO, Chief Nursing Officer there, while I was finishing up that degree. And so got to experience healthcare on a national level. So, we do try and hook you up with those different types of experiences. From there, I got my master's, went to home care, and was a director of nursing. Fell in love with teaching. For me, it's that leading part and helping people grow. And Haley can kind of walk through and just talk about that. But seeing the light bulb come on and, putting those pieces together, I experienced that as a nursing leader, helping my staff grow, and their development, and that kind of led right into nursing students and teaching. So I was fortunate enough that I did a Saturday clinical at the VA hospital on the unit that I was working on, and loved it. So I went to full-time teaching then. So, and that was, oh gosh, back in, 2006, 2008. So that's how long I've been in nursing education. While I've been in nursing education in different leadership and teaching positions, I have tried to remain current in my practice. I still work night shift rehab in a hospital on the weekends. I also do some phone assessment type of things for insurance companies. So there's so many things that you can do. The advantage of starting with a master's degree is it does open up that door a little bit more for you as you go forward. We all do need to start at the bedside, and have those experiences, especially in clinical. You don't have to know what area of expertise you want to go into, because you are going to get so many experiences along the way. And as you can tell, I have done a little bit of everything. Like I said, soup to nuts, hospital, home care, rehab, leadership, mental health, and all of those things. So those opportunities and those doors will open for you, and you'll be able to, kind of find your way through. I'm a jack of all trades, master of none. I do know that pediatrics and OB are not for me. So that part I do know. I do know that it's, taking care of adult patients. Whether
Adrenaline junkie.
yes, no, not me. No, my pediatric clinical when I was in nursing school back in the early 1990s, that was when the diapers were still pinned, and I had to try and change the diaper of a little newborn. And so I was so worried about poking that baby with a needle. And then they came out, and that was when Pampers first started. And I could not figure out how the heck to put that diaper on with gloves, right? Because of that sticky tape. And it was my hands, and it was just like, nope, not for me. So, but as you go and as you have those experiences, I have found, so many different paths and so many different ways of making a difference. So, and that's the one good thing about, being a nurse. You make a difference every day. So make a difference that you don't even know. I just ran into an old student of mine that I didn't even know, and now she is, working in insurance. Students that I have taught are professors here in this program. So the impact that all of you have, that is my success. So as an educator, so that's my pathway.
That was a good one. That was a really good one. Thank you. Thank you, Dr. Kutsky. Haley, how about yourself? And she's a very special guest, everyone. I mean, she went through this program, and now she's standing here as a faculty member. I mean, that's really amazing to see. So I would love for you to talk about that as well. But yeah, do your introduction and then go on and maybe talk us through that.
Yeah. I think my pathway to nursing is probably shorter than theirs. But, I still had very similar experiences. I also, like Brenda, just went to college. I was like, I'm getting out of my parents' house. I don't know what I want to do. I was kind of in the back of my brain. I was like, maybe I want to be a nurse. But I went to Illinois State, and you have to apply as a nursing student, as a nursing major there. So you can't decide that's your major after you've already started there. And then while I'm at Illinois State, I have like some very close family members get very sick and pass away. And I'm like, you know what? Nursing, I'm seeing these nurses interact with my like loved family members, and the way that nurses are impacting their care, they're with them at the bedside so much more than really anybody else in the hospital. And I loved that. I was like, I want this person's life to be like kind of something that I am helping take care of, and like seeing them recover and get better. I really wanted to be doing that. So as I'm in college at Illinois State, I'm taking my prerequisites to do a different nursing program, some kind of accelerated nursing program after. I had decided that already before I had graduated. I originally also thought that I was going to do pediatrics. Nope. Never hung out with a little baby patient in my life, aside from a clinical rotation that I had. Yeah, and then I graduated. I, in the meantime, was working as a caregiver for a company. I wasn't licensed in anything, so I was just hanging out with the person, taking them to the toilet and stuff like that. And I was like, yeah, I really do like caring for people. So then I applied to a couple programs. I chose Marquette, obviously. This is where I went. I was them one day, years ago. And I went through the program. I loved it. I think it was great, very well organized and everything. But yeah, I ended up with my master's degree, obviously. And then since I live in Illinois, I started working at Northwestern Memorial Hospital, downtown Chicago. And I love it there. If I could have a part-time job or a PRN job there, then maybe I would do that. But now I live in the suburbs, so it's a little bit more of a commute. Yeah, when I started at Northwestern, I was working in med-surg. And like Brenda said, that's like jack of all trades, master of none. That's like general nursing, all types of things you're seeing. So it's geriatrics, it's medical patients, and it's surgical patients. But no real like specific specialty kind of patient is there, especially at Northwestern, where there's a unit for everything. There's a surgery unit, there's a medical ICU, a surgical ICU, a cardiothoracic ICU. There's units for everything in Northwestern. After a couple years there, and I was precepting a lot of new grad students as well. And as I'm precepting people, I'm realizing that I really like to teach. I really like to teach those new grads that are coming in, remind them of all the skills that they learned in nursing school. Like, remember how to start an IV and all those other random little things that you learned throughout school. I love doing that. But after a couple years med-surg, I went into the medical ICU at Northwestern as well. I learned a lot there. There's so much to learn in the ICU. A lot of different devices and diagnoses and things that you wouldn't see in med-surg or you wouldn't see in a smaller hospital. So I think my experience there in Chicago was great. But then, a position opened up here and I was like, hey, why not? I loved the program while I was there. So I love teaching here now. Like I said before, I'm teaching the 6013 class. That's the lab class where I'm teaching you how to do a full head-to-toe assessment. This week I just taught them the neuro system. So we were just learning all about neuro today even. And then, in the following weeks, we're going to do a bunch of fun skills. Usually the skills that the nursing students really want to do, like put in an IV or put in an NG tube, program an IV pump. Like all the fun things are kind of in that class. And then you keep doing them throughout the whole program to continue learning that. Yeah, that's my pathway to nursing. Yeah.
Thank you, Haley. That was amazing. And just quick question for you. You were in the program. You said you ended around COVID time. Is that correct?
Yeah. COVID was like a whole year. So it was the majority of my time in this program was COVID.
Okay, gotcha. So it's a little different maybe, but just going from when you were in there, now it's 5 years later?
Yeah.
Have you seen the program just evolve in that
Definitely.
Definitely.
Yeah. Mm-hmm. Yeah. There's a lot of different resources and things that we're using. On my end now as a faculty member, I can see all of the different ways. We have a lot of different modalities of teaching students now. So yeah, the program is definitely growing and expanding and improving in different ways to teach. We used to use Kaplan, now we use ATI, and ATI is great. So, but yeah, I think I literally only had 2 months of nursing school that was not COVID times. Yeah, because I started January 2020. Okay. And then it was March, and we were oh wait. Yeah.
Awesome. Yeah. Thank you, Haley. Thank you so much.
I survived. Yeah. I made it out.
Awesome.
I think I was cohort 8. Yeah.
And that's what we do here. After every group, we keep evolving and becoming a better program. And it's just awesome to see. And I'm sure Dr. Brenda Kutze can attest to this, her being here the very first program, and now seeing we're going to be welcoming cohort 20 in the spring. So it just keeps growing and growing and growing. Thank you. Yeah. Thank you so much.
And I was working with Brenda when I was in the program. I was emailing her and be like, hey, can you help me with this thing? She's been here the whole time. Yeah. There you go.
Awesome. Thank you so much.
Hello. Can you guys hear me? Okay. I'm Angelina. Introduced myself before to some of you guys, but if you guys didn't, I'm Angelina. I'm from Tampa, Florida, and I went to University of South Florida and got my Bachelor of Sciences from there in Biomedical Sciences, and I'm currently 4th semester out of 5 of cohort 17, and right now my long-term kind of career goal right now is midwifery, women's health, kind of that route. But I actually just, and this is the complete opposite, but I actually just had an interview for ICU extern at Aurora Medical Center yesterday in Kenosha.
You'll love that though.
I hope I get it, because we'll talk about externships, down the line, but definitely hope I get that, because it's I wanted to kind of dip my toes and see if I would like ICU, because I've heard from a lot of ICU nurses that once you're an ICU nurse, you don't want to go back. So kind of just want to dip my toes and see if I like that. But right now, midwifery is the goal. I have 2 cute little nephews, a 4-month-old and a 2-year-old. So, and my sister decided to have like a water birth. So those all kind of just influenced me to kind of go that route. Just seeing how great of an experience she had with midwives. But fun fact is I'm a very indecisive person. So when I was little, I wanted to be a fashion designer. And then from there, I was actually pre-med. And then I decided to be pre-pharm, then pre-PA. And then I finally landed on nursing at Marquette. And honestly, I'm really glad I made that decision. I really wouldn't have wanted it any other way. And that kind of brings me to this program. I love how I've met a lot of great people. One of the things I really like is I've made lifelong friends, friends that I know that I will, invite to my wedding. Like, that's how close I've made friends in this program. And I also love the flexibility and just being able to balance that time. And for those of you who have full-time jobs or families, it's definitely manageable, and they're very flexible with choosing your days and kind of just creating your own schedule. So that's what I really like about this program, and I'm almost done, so 2 more semesters left. I'm really excited. But yeah.
Thank you. And I just want to echo one thing that she said is like the people you meet in this program. And that's one of the best things about this program is that you guys go through it together. Like you guys are the ones, you guys rely on each other when things get tough. So you guys like develop really strong relationships with each other. You will become best friends. These are the people who will be at your weddings if you aren't already married, or you'll be at the other one's wedding, right? You make lifelong friends. So that's what's like the community that I was trying to talk about earlier. It's a very strong sense of community. But thank you so much, Zach.
Hello. My name is Zach. I don't really have a hometown. I lived all over the United States growing up, so both coasts. This is my first landlocked stay, as in not on a real coastline, even though the lake is like an ocean. My undergrad, I have a Bachelor's of Science in Communication, Public Relations, and Hospitality and Tourism Management from Appalachian State University in Boone, North Carolina. That's a mouthful. And so I'm coming from a very non-traditional background. I have 0 healthcare experience. I did not do biomedical sciences. I had no idea I wanted to be a nurse until like 17 months ago. And that's long story short. A friend of mine was in a car accident, and he was standing on the side of the road and got hit by a car, motor vehicle accident, and he spent 60 days in the ICU. And I had just quit my full-time job to go to a different grad program, and decided that I would spend that time with him in the ICU because I had the free time, and it exposed me to nursing. So I discovered nursing, kind of similar to Haley's story. I watched these nurses impact his life and see how they could change his life and improve his life. And I was like, I kind of want to do that too. That sounds interesting. So I started my prereqs a little over a year ago, and now I'm almost halfway through this program, which is crazy to think in a year
how much
my life has changed. I've moved across the country, driven cross country twice, 8 times total, but twice in the last 8 months. So that's my fun fact too. Current semester, I did talk about that, is, where are we at? 3. Sorry. Alex and I are in the same one, but we had 2 exams today, so there's not a lot going on up there anymore. But we're in semester 3, cohort 18. My favorite thing about the program, people for sure, the faculty, they really care. They really want you to succeed. You know, these are not easy classes that you're going to be taking. This is hard. It's nursing school. It's a master's program. It's accelerated. Don't let anyone fool you. It is chaos. But the people that are sitting at this table have a handle on the chaos. They have a control on the chaos. And so to see them have a control on the chaos motivates me to be better and have a control on my chaos as well. So they really contribute to the, you know, you can get the same education anywhere. Nursing school, for the most part, is pretty much the same anywhere you go. It's textbook, but it's the people that make it the best. And I think Marquette has one of the best programs for sure. Is that good enough?
Thank you, Zach. And one thing again, I love some of these answers. Go on, Brenda.
I want to know where your clinical is.
Oh, my clinical is at St. Luke's, Aurora St. Luke's. It is a level 1 trauma center, right? Yeah, I think so. On a neuro step-down floor. So that's like a neuro, how would I say that? Between the ICU. Yeah, thank you. Between the ICU and like, you know, just like a general med surge. So pretty intense, honestly. It's kind of scary to go in there and be like, oh, these people are very much on the precipice of like severe injury. So you're kind of, you know, palms sweaty, knees weak, arms heavy every day. You go in there a little bit, especially being it's only our second clinical. So you, in your first semester, you don't have clinical. In your second semester, you start clinical. And your third semester is when you kind of learn what clinical actually is, in my opinion.
And you're not alone.
And you're not alone. Yeah, there's 6 other people suffering alongside me, and
suffering.
I mean, no.
What?
And
suffering.
we have. I have
the fun part. It's the fun part.
I have a really, really, really amazing clinical instructor currently, and I had an amazing one last semester as well. I think we have some of the best clinical instructors. Obviously, this is my only experience with nursing, so maybe a little jaded, but I really like these people. Alex, go ahead.
Alrighty. Take it away. Hi guys, I'm Alexandra. Mostly everyone, can you guys hear me? Okay, awesome. Mostly everybody just calls me Alex. My hometown, so I was born and raised in Cuba, and then I moved to Miami, so I've lived in Miami, Florida pretty much my whole entire life. For undergrad, so I actually thought that I was going to go into like computer science and tech. I actually had a lot of my family like pass away like in Cuba, and we lacked a lot of like medical resources, and just seeing the care that they like gave my family, especially like my grandfather, that really like kind of just altered like my perspective. I was like, you know what, do I really want to be like working at a computer and like a tech job like for my whole entire life, or like do I want to be helping people? Like I was with my grandfather, like I remember like in high school taking all of my exams early, and like, you know, making sure that like before I graduated I was there like before his passing. He wasn't able to make it to like my graduation and all that stuff, and I know that a lot of people, even working bedside, like sometimes you don't have your loved ones like, you know, throughout the course of like, you know, the rest of your life, and to see you achieve all these goals, so being able to like make an impact like in the bedside and working with people, that I knew I wanted to go into healthcare. Originally I was in the pre-PA track, so my undergrad was in psychology. I did a minor in nutrition, and I got a certificate in business analytics. And then I decided, you know what, like in all of my jobs, I worked in a trauma 1 center, and I also worked in the NICU. I was like, I barely work with any PAs, so I work mostly with nurses. Why don't I try nursing? And then I started looking into MSN programs, BSN programs. I was kind of comparing and seeing, you know, getting all the stats and numbers. And then that's how I landed in Marquette. The advisors, the whole process, like I thought everybody was so friendly, even through the phone, like being all the way in Miami, not being able to come in person. It was such a great experience, even just talking through the phone. So yeah, you guys made the process amazing. Current semester and cohort, so Zach and I are in the same cohort semester. We're 18. We're currently in our 3rd semester. And then my long-term career goal, I definitely see myself anywhere like in like trauma 1 center, pediatrics. I know, like, I guess contrary to popular belief, I actually love home health, and I love hospice as well. So I could definitely see myself doing that as like a part-time, or even like on the side, like as well as working bedside. So yeah, those are my long-term career goals. A fun fact about myself. So I guess like I'm a CPR instructor, so I teach here. Even though I moved from Miami, I teach in Deerfield. I teach sometimes in Milwaukee, and like certain little parts of Illinois. It depends, like the class that I'm teaching. I teach for like non-healthcare providers, and then I teach for healthcare providers. So I can be teaching like anyone from like a physician, like a dentist, to like someone that's like never taken CPR before in their life. So it's really nice because it also like it's like a way of like keeping me going, you know, like I get to see people from all types of backgrounds, and like it's so motivating and like encouraging. So like you're like, oh my god, like I'm in nursing, and then you see all these people in like amazing fields, and you get to share like your experiences while you're teaching. Favorite thing about the program, definitely the flexibility. The staff is amazing, down from the advisors, from your sim lab, like the people that prep your sim lab, Brenda, Holly, everyone that's sitting here right now. You're definitely going to make friends that you can count on, group chats, you guys can debrief together. And yeah, I would definitely say that like that's the best part. You can work part-time as well, and you have the flexibility to do things outside, you know, like whether you might want to work part-time or full-time, or maybe you just want to hang out with some people in your cohort. We also plan exciting things for the cohort, and yeah, those are some of my favorite things about the program.
Awesome. Thank you so much for sharing. Thank you everyone, to the panelists, everyone for sharing all great stories. But now it's a Q&A session, right? Like, what do you guys want to learn? So does anyone have any questions for our panelists? Yes.
For like clinicals, are you kind of filtering through all the different areas and specialties to kind of see what you like?
So the question was, for clinicals, do you filter through specialties and areas that you like? Is that correct?
Yeah.
No. Your first two clinicals, and Dr. Kudzi can also talk on this too, your first two clinicals will always be med-surg of some kind. So the neuro floor I'm on is a med-surg floor. It is just focused more on neuro. So like I had a patient there the other day who wasn't even a neuro patient. They just were overflowed from a different unit. And then you can put in a preference. So a preference sheet goes out every semester, a few weeks before the end of, well, a couple months before the end of the semester. And you put in your preferences of location, time of day, and if once you're in your fourth and fifth semester, you can put in for a specialty. So you're on the same floor the entire like semester. So I was on last semester a renal med surg floor the whole time, and then I'll be on this neuro one and for the whole time. And Angela, you didn't get to see your.
Yeah, so I'm actually on OB floor right now at Ascension All Saints, which is in Racine, and I actually had clinical today, so sorry if I'm a little out of it. I'm tired. It's been an early morning. Early start to the day, but yeah, like Zach was saying, my first clinical, I was at cardiac floor on 10S at St. Luke's, which was cardiac and angio floor. And then second semester the next semester I was on med surg, and then fourth semester they open up the specialties, and I really wanted OB, and I definitely checked only OB on there. Even in the additional comments, I think I put I really, really want OB, so I was like set on that. But yeah, it's been pretty great, and I think the other specialties they offer is like ICU, ED, peds, OB, and then they'll place you based off of your preference.
Brenda, were you going to say something about the clinicals? No?
I have one thing to share.
Okay, yeah, go Holly.
Okay, so in regard to clinicals, most of them are focused on adult acute care, and that is by design. So adult acute care is the cornerstone of clinical practice as a nurse. It's the general foundational skills that you need to succeed no matter where you then choose to specialize in your career. And it's also the foundation of NCLEX. And so NCLEX is really centered primarily around adult acute care. Now, a med-surg unit, medical surgical, is considered kind of that all-around, like Haley was saying, general nursing. But most med-surg or adult acute care units are getting very specialized in the sense that one might be focused on cardiothoracic care. One might be focused on hematology, oncology. Another might be on orthopedics, wound care. There's all sorts of different specializations depending on the hospital system that you encounter. But like a cardiac nurse can't easily go and float to an orthopedic unit. Like I don't know what to do with a traction machine. I don't want to know. I just have no desire to learn how to crack bones or whatever they do over there. That's crazy stuff. I don't know. Heel bone. Okay, sure. If you say so. It's just scary contraptions. No, thank you. But, assessing person after a stroke, I'm all in. I can do that. Or helping to deliver a baby, I'm all in for that too. So, so the med-surg stuff it can be highly specialized. So you're going to get a variety. You also might have opportunities to shadow. You can also have like a more specialized population care experience in 4th or 5th semester. And we also have nursing panels where a couple times a year, our student success specialist up in Milwaukee, who's over all the grad programs, provides programming where you get to, for an hour, you sit and talk to a panel of experienced nurses about their pathways and their different specializations. So we've got one coming up in a couple weeks. I'm one of the panelists. We've got somebody who I think did nursing leadership. We've had people who are midwives, CRNAs, and so forth, and they'll talk to you about the different experiences they had and then how to connect you with program leaders and so forth that can talk about next steps or even what a bedside career looks like. So you'll get experiences and lots of context to help you decide and be exposed to things as you go.
I was going to say, the more specific medical surgical experiences are going to be at your larger hospitals, like you were talking about. We also do have clinicals at our smaller community hospitals. And on those units, again, you're going to see a wide variety. They don't have those specialized units. I still work out at Oconomowoc Aurora Summit. They have a medical unit, a surgical unit, a step-down unit, a rehab unit. So on that medical floor, when you think about that, that is going to be any type of medical problem that someone could have. So whether it is a GI, I'm trying to think, wound care, any type of thing like that. Infection, right. So respiratory, right. Yep. So all of those things on that medical unit. Whereas surgical, again, those are going to be focused on those that have had surgery or need surgery. So, and again, that could be anything from orthopedics to spinal to what else? Gallbladder, right? Cardiac, whatever. So we do have a wide variety of experiences. Again, those smaller community hospitals, and again, all the way up to our level 1 trauma. You do put in a preference and take a look at that. Is it guaranteed? Absolutely not. I do my best. I've got a great team that helps me secure, and having those relationships, those wonderful relationships with our clinical partners, really helps with that. But I do my best. So, and these guys can answer to that. And I guess that's all that I got to say about that. But it's a wide variety. So.
Thank you so much. And we have 2 amazing questions from online, and then we'll get to more in person. One question is for student ambassadors and one question is for faculty. So for the first question, for the student ambassadors, so do you guys work throughout the program? And if so, do you find it that you're able to work more during certain semesters versus other semesters depending on the workload? So can you guys each answer that and give us your perspective on that?
Wait, I guess I'm the only working ambassador right now. Okay, so I would say definitely like throughout your first semester, like get a feel for it. Like you are just stepping into something brand new. Like manage your classes. You're gonna be taking heavy loads like patho, pharm. So see how you do with that. Try to, if you are gonna work, get something that's very flexible, at least with your schedule. Right now, I mean, I work like kind of like multiple like part-times. Kind of reminds you of like Odie, because Odie was like, I do so many things. But yeah, so I teach CPR like on the side. I just started actually in the Marquette building, so like where the BSN students are. So I set up like their sims and I get like all their meds ready, like basically just prep the room for like the following week. So anything that they're going to be working on, like last week they did vital signs. So I set up like all their blood pressure cuffs and made sure that all the mannequins were ready. The tables were ready for them. They had like all like their like safety supplies and things like that. So I basically just turned the room for them, since there are like 3 levels to that Marquette campus. Highly recommend you guys go as well and check it out. You guys can schedule like sim times, lab times here to practice, but you guys can also do it at the main campus as well. And I'm there on Fridays, so if you guys want to see me and just practice with me, you guys are more than welcome to. I also work at a fitness studio, Burnside.
So you are just like
I'm kind of just jumping around. Gotcha. So yeah, I do those 3 jobs, but they're all part-time and they're really flexible. So like, let's say I can't make it to one, then I just say, hey, I won't be able to come in this Friday, or like at the studio, I'll just be like, hey, can someone cover for me, you know? And it's okay if I'm not there. So I highly recommend, if you are going to work, that at least, you know, you guys like either have a good relationship with your manager, it's flexible, maybe it's on the weekends, only a few hours. And if you do decide like, hey, I can handle this workload and you want to move up to full time, then it's completely optional up to you. You know, we don't discourage you guys from working.
What about you two?
I'm unemployed currently, but I've been very fortunate. I didn't have to work. I sold my business and my house when I moved here, so I was, you know, kind of set for a little bit. Unfortunately, that money has gone with the wind. So now I am going to be getting a job here soon. I also was kind of doing what Alex was talking about. I wanted to get settled here first. I moved cross country, didn't know where I was going, didn't know what this program was going to be like once I got into it, so I didn't want to have a job right away. But something I found out, which I think is really awesome, is your first semester courses qualify for your CNA education. So you can submit a waiver and get like the class waived, and then you just have to take the exam. So you get like the same level of education, pretty much you're learning the same skills in the hard skills lab, and then your foundations course counts for the actual like in-class part. So you just have to take a written exam and a skills exam. I just did that. I passed it. I'm not going to say it was like the easiest thing in the world, but it was pretty easy. I feel like the education here is pretty good. So I will be pursuing some sort of like health unit coordinator or CNA or tech job here soon. A lot of people in our program do have jobs, part-time jobs. I would really emphasize though what Alex said, to, if you can, to get settled first. See if you can get settled first, because if you can find a way to like not work, I would recommend that. There's a lot to do. You're doing a lot every single week. You know, I think first semester it was like 40 to 50 hours a week, trying to make sure I knew everything that was going on and have a handle on everything. I also am involved, obviously, ambassadors. I'm on a student conduct council here and a couple other things that I'm involved in. So I have other extracurriculars that I do that unfortunately I don't get paid for, but happy to do them, and they are going to be great on my resume when I graduate.
Yeah, I'm also unemployed. I just took out a bunch of loans, and that's how I pay for everything. So but I get a school deferment, so I don't have to worry about it until I graduate. So it's pretty nice. But I do have friends who work full time. I think I told a few of you guys, and they're able to, it's just all about time management. The only thing I would suggest is summer semester is shorter. That means it's more tightly packed. So it's going to be a little more hectic compared to fall and spring semesters. So I would just be wary of that with your flexibility for summer if you have it, if you're working. But other than that, fourth and fifth semester kind of dies down a little because like right now I'm in my fourth semester. We only have one exam a month, and most of our assignments are online. So there's definitely a lot more flexibility with that. And fifth semester is purely NCLEX prep. And I believe there's no simulation fifth semester too. So yeah, so you definitely have more flexibility in those semesters, but honestly, it's very doable. It's no one's going to tell you not to work during this program, but they will say just be able to time manage and create a good schedule that'll work for you.
Also, in your fourth and fifth semester, you can apply to externships, which are usually 1 day a week as a nurse extern. So you're pretty much a nurse, just like unlicensed. You're like a step above at clinical. You have a lot more autonomy, but it's paid. And that's where, if say you don't get the clinicals that you want, you know, you're like, I want that OB clinical, you didn't get it, there may be an OB externship that you can get, and then you can get paid to do it instead. And you have a lot more of like autonomy, time with the nurses one-on-one. You're not in like a big giant group. It's more kind of specialized as well.
Yeah, and Haley, did you work during the program when you were?
I did work during the program, and I did what Zach did. After my first rotation of clinicals, I used those hours to like not have to take the CNA course. And then I worked part-time as a CNA at like the community hospital down the street from me. And luckily they were very flexible with me. They understood I was a student. So they knew, like, I would be like, every semester I'd be like, I can only do Tuesdays and Thursdays this time. And they'd be like, okay, well, you're going to work Tuesdays and Thursdays. And it's also great to do something in the hospital, in healthcare, to like supplement your learning. You're like, ooh, can I actually take that blood sugar? I would love to learn. Like, I've learned how to take a blood sugar, but now I get to do it on a real person. So that was always like really exciting. I'd be like, oh my gosh, we just learned about strokes this week, and like now I have a stroke patient or something. Helping with like the basic skills like bed baths, whatever. Like, yeah, So working during the program is doable. You just have to be like the organized type of person that can time manage. And it has to it doesn't have to be a flexible job, but it's great if they are flexible and understanding you are a student. And then a lot of times those externships or those jobs that you have are going to probably have a spot for you when you graduate. They're gonna be like, hey, you want to work here? Because we know who you are. We've trained you on our unit. Now you have a license. There's a spot for you. Yeah.
And Haley, while I have you here, I do have the next question is going to be for Brenda and Holly. But Haley, while you have the mic real quick, just since you've gone through the program and everything and all the things you've done after the program, what would be your biggest tips for students during their clinicals to ensure they're successful at clinical?
During clinical specifically,
yes.
I would say just being prepared and knowing the stuff in advance, kind of. Knowing the things that you learned in class, having that fresh on the top of your mind, not something you haven't thought about in months. Just kind of always staying up to date on the things that you learned in the previous semesters. Because I'll see it teaching in clinical, I'll be talking about labs or something, and my students will be oh, I don't remember that very much. But if it's in the back of your brain, you're going to make those connections a lot quicker. And it's going to be a lot easier for you to put the whole puzzle together and it makes sense. And you can see those students' eyes be oh my gosh, I understand. I understand why their labs look like this, why we're giving these medications, why their vitals look like this, and how they're all working together to make that person better and why this is happening to this person. So just know your stuff, I guess.
Know your stuff, people.
Know your stuff. That's a very vague tip, but I feel like it's very important.
Well, thank you, Haley.
Go.
I
have an answer for that one.
Go,
Also.
of course.
So, as a clinical instructor, you are not expected to know everything, though. No, you're not. You're not expected. As a clinical instructor, if my students weren't asking me questions, then I was nervous. So you are there to learn, and you have a group, and you have an instructor. And again, that's the fun piece of it. You are learning and growing together in your nursing practice. So, and as an instructor, I would say that don't be afraid to ask those questions, to seek out opportunities. You get out of clinical what you put in. So if you are there volunteering, you are answering call lights, you are asking questions of the nurse, of your instructor, getting those experiences are what makes clinical and makes patient care so satisfying. So whatever job you're working right now, you know how much effort you put in, right? And that's about how much you enjoy your job. You know, some days you put in more effort than others. And it's the same thing with clinical and your educational experience. What you put in is what you get out. So that would be my tip and suggestion.
So, Haley, I love what you said. And you might think it's a vague tip, but I really think one question I wish students would ask more in their theory courses is give me an example, like to their professors, give me an example of how the concept I'm learning here might come up in my clinical practice. Because everything you're learning in the classroom is relevant to what you're going to be doing as a nurse. Ethics, whatever you're doing. Quality and safety, informatics, like think about all the different things. Evidence-based research, right? In regards to working, I have heard multiple, because I've done a lot of these panels now, I've heard multiple ambassadors say, working is fine, but think in terms of something's got to give. You are adding another full-time thing to whatever it is you're already doing, family, whatever else you have on your plates. You're adding full-time grad school. You got to make room for that somehow. So if work is not something that, I had to work through all of my degrees. So I get it. If work is something that you can't just say, oh, I'll just be a person of leisure and not work. Well, we get that. We totally get that. But something's got to give. So it might be, hey, I'm not going to have the social life, the robust social life for 5 semesters. And my friends will understand. They'll be there when I'm done in 5 semesters. It's less than 2 years, right? So think in terms like that. What am I willing to sacrifice to fit this in? in regard to time management, we also provide an academic coach. So you can meet with an academic coach to look at how to study like a nurse, because thinking like a nurse is absolutely a different skill set, even if you have medical background, healthcare background. So time management, study skills, study strategies, even stress management, test taking skills, they can help with all of that. And that's something that you get. That's an advantage of coming here to this program. We have a full-time academic coach on staff that can help you with all of those things. So, and the CNA job, immersion. You can watch and see what the nurses do, see how they go about things. Sometimes learn what not to do. I will say I've had those experiences too. So.
Yeah, thank you, Holly. And Holly, with you, keep the mic because this question it's a really great question online. And then we're going to go back to the first questions. Does the curriculum include current event topics, changes in healthcare that are occurring, and how they impact people of different socioeconomic statuses? So how does the curriculum address these problems?
So each professor certainly can refer to current events. I know many of us, part of our pedagogical approach is to keep an eye on current events and bring relevant topics into the classroom for discussions and so forth. One of the courses that I've started teaching recently is ethics. And so certainly with ethics, we have some really good discussions. I try to bring in some current situations or circumstances relevant to healthcare and medical field in general and get some really good, robust discussions going. What else? So that's a long question and an involved one.
Yeah, it was a long question. Then I added a flare to it. I probably shouldn't have added my flare.
Oh, so that's
it was
a
my
torn
flare
special.
that ruined it,
Okay.
I think. It goes, yeah, the flare ruined it. Does the curriculum include current event topics, changes in healthcare that are occurring, and how they impact people of different socioeconomic statuses?
And so one of our Marquette Nurse characteristics is social justice champions and also advocates for the vulnerable. And so we kind of infuse that into all of our throughout the curriculum. I mean, we want to make sure that when you are learning to become a Marquette nurse, that you understand how you personally can affect change in those areas. Let's see, I'm trying to think of some of the other courses in the curriculum that specifically address this. Organizational and system leadership, that's definitely a course. You'll get to that in your 5th and final semester. Community population health.
And Holly, I
right?
think also to
evidence-based
that point,
nursing.
does the curriculum get updated? Yeah. It does. We just went through a curriculum update recently that just happened that got implemented. So it does change with current times.
We are absolutely. So one of the things that we are in the midst of doing, we align with the Essentials for Nursing Education, which is really a standard that any accredited program in the country is going to align to, and that is put out by the AACN, the American Academy of Colleges of Nursing, so they come out with these essentials for nursing education. They have different domains of learning, competencies that are expected, subcompetencies, different levels of competencies and subcompetencies, performance indicators for all of that. And so we are aligning our curriculum. New standards came out 2 years ago, and it's a process that over the next couple years, all of the programs in the nation really that are accredited. We are accredited by CCNE, which is their accreditation arm, and so we are in the midst of working through and really converting to a competency-based curriculum. And what we have found is our curriculum is in really good shape, but we are always trying to improve. And so competency-based, it really focuses on making sure that you develop those action-based things. Like we can see that you demonstrate that you have acquired and assimilated the knowledge and the skills and the attitudes that you need to be a Marquette nurse. So,
thank you, Holly.
I do have a little bit
Go on,
to add.
Brenda.
I know. A part of that also is that surveys do go out with every semester with your courses again in getting your feedback. So when it comes to satisfaction in your learning, that you do be able to give that feedback, that you are able to give that feedback. The other thing is that you are a Marquette student. So even if you are part of the Pleasant Prairie campus, you also have access to the main campus in Milwaukee. So, and there are events that, do take place. We do have our commitment to the profession ceremony that is on the main campus coming up not this Saturday, but the 28th, next Sunday. So also you have access to all of those things, the library, the rec center, all of those things that are on the main campus, along with our facility here that you have seen. The other thing I would like to push is Marquette basketball, because we were a ranked team last year. So
we got a little basketball corner.
I know, yes, in the student lounge.
Yep.
So, but again, anything that is open to Marquette and all the communication on the main campus, everything down from the provost, and all of those activities, you are a part of. So as a Marquette student, so
thank you, Brenda.
Yeah, on the going back to that question that you asked, Torin, about the academics, I find it really interesting because academics is not always the most flexible thing in the world. It takes a couple years for academics to catch up to teach about something that happened. But what I have found interesting is we're in our community health class right now, and like half of the questions are about COVID. And I find that really cool on one hand, that I'm like, okay, cool, we're learning about this big thing that happened. But then on the other hand, I'm like, is this ever going to be applicable again? I don't know, possibly, but hopefully not. Hopefully not. And so it's kind of like how has that big thing that happened in the world impacting our learning? And so I think it does take a couple years for big social things like that to impact education and change, but I think the Marquette faculty, especially the ones that I've experienced, do a really good job of talking about current events and topics when it is relevant to what we're learning.
Thank you. Awesome. Any questions from in-person audience?
I have several, so I'll probably ask two, and then if anybody else wants to.
Of course.
For those of us that are starting the summer program, because it is 8 semesters, I know that you're talking about how clinicals and simulations start the second semester. Is that also the same for summer, or is it spaced out differently?
Yeah, that's a really great question. So the question basically is, for the students who start in the summer extended program, the 8 semester option, basically how often are they coming in for clinicals, labs, and what does that structure look like? Do you know off the top of your head?
So I don't have the 8th semester memorized, but I can tell you, in your first semester as an extended option student, and again, keep in mind, this is considered full-time because you're taking enough credits that for a graduate program, you're still considered full-time. It's just a kinder, gentler pace. So you will take advanced pathophysiology, pharmacology, and essentials of nursing practice in your first semester. And then in semester 2 is when you will get into health assessment and your lab course, along with ethics, probably with me. And then semester 3, you have a few additional theory courses. And semester 4, your second summer, is your first clinical. Okay, so that is how that rotation goes. And then you don't have clinical in semester 5 in the fall. No, semester, that would be...
I got it right here, too. I just pulled it up.
Then it's like spring, summer, and fall of your final year back-to-back clinicals, so that the final 3 are in a row, I believe.
To give you a really quick
Am I right?
Snapchat highlight for those, again, summer extended option. So semesters 1, 3, and 5, you don't have lab or clinical. 1, 3, and 5. No labs, no clinical. Your only in-person obligation is coming in person for exams, and the rest you'll be doing your coursework online, and all the other semesters you're coming in person for clinicals and labs. Yeah. So you get the same amount of clinical experience, same amount of lab experience. Everything's the same, just you get to extend it over 8 semesters.
Curriculum is exactly the same. It's just a slightly, it's just stretched out, but the courses are exactly the same courses. So yeah, semester 2 is lab, semester 4 is your first clinical, and then semesters 6, 7, 8 are the next 3 clinicals. Now, we have actually had people say, well, can I just come to town for midterms and finals, or can I, those types of things? And no, I mean, there are, so exams are all proctored in person on campus. Skills lab is on campus. Simulation on campus. Clinical is off campus. And then again, simulation, we consider on campus clinical versus off campus clinical in the hospital settings. Simulation is evidence-based. There was a huge study done in 2014 by the NCSBN about simulation, and validated that up to 50% of clinical training can occur in a simulated environment without any loss of skill acquisition. So Absolutely evidence-based teaching is what we embrace here as nurses, evidence-based practice, right? So that's carries over to teaching. So there are plenty of on-campus activities. So it's not something you can do fully remotely by living in Florida or California or Maryland or all the places our students come from. So,
And just to tell everyone, we do have about 15 more minutes, so just keep that in mind. But you have another question?
Yeah, so following up on that question, given that the first, third, and fifth, there's no lab or clinical and we're technically not coming, what is the best way to ask questions to the professor to make sure that we succeed and that we get help during those semesters?
Yeah, so the question basically is, and this is kind of broader for everyone, so I like how you're doing it for the extended, but this goes for everyone basically. What's the best way to get access to your professors and to ask questions and get information from them, right?
Yeah,
especially if you're in the hybrid program, right? So you three right here, you guys go through the program.
Yeah,
how do you
I
get
think
access to your
ambassador-
professors? How do you get that support? If you can kind of talk through that a little bit.
So I usually use, it depends on the professor. A lot of professors prefer, some prefer Canvas, which is, where you'll access all your classes, but most of them prefer emails, just because they check their emails often. So they have their Marquette email. And then they have office hours. A lot of the professors that have office hours on a certain day, probably for like an hour or two, and you can bring your questions to them and they'll answer those questions for you. But yeah, those are the ways that I reach out to my professors. Yeah.
So with the office hours as well, you guys can schedule like individual like office hours like with them. So like they'll either like make it access like through announcements. It'll be like in the emails. Sometimes like you have to double check. Like it can sometimes be like the professor directly sends that email to you, and so you schedule it through that link that they sent there. But usually it should be on Canvas, like under like the modules or like their announcements page. And then in terms of like office hours, let's say like you are like working part-time or anything like that, when it comes to like the work related questions, like those office hours are always recorded like the majority of the time, so you can always go back and maybe sometimes like even those questions that you had prior, like, oh, I didn't understand like this one topic on the module, like maybe another student already had that question and you don't have to email the professor like about it, so you can be like, oh, I'll save myself the time and the professor the time and then I'll go there. But the professors are always there to help you, so please like feel free to ask like any questions you have to them. Okay.
There are so many resources at your disposal. Obviously, we've already talked about email. There's weekly office hours that they host, but there's also, Professor Neroni talked about our academic success coaches. I can't even say that. Coaches. And then we also have tutors. There are three tutors that are staffed, so they are paid to be like available to you, and they have office hours set up. You just go on their little Calendly, sign up. You can sign up for like 30 minutes, an hour, 2 hours. I mean, maybe don't take up all their time, but they're available for you. And they, I think, have all of them gone through the program, right? Yeah, all three of them are graduates of the program. So first semester, I met with a tutor weekly, every single week, sometimes multiple times a week. And that's what got me through the first semester, adjusting, especially because I don't have a background in healthcare at all, like zero experience whatsoever, except for like, my own being in the hospital. But having a tutor that is not only gone through the program, but is actively a nurse still working was the best thing that could have ever happened. And that's really what got me through. So that, and then like Alex said, signing up with your professors, reaching out to them, just even emailing them to introduce yourself so that way they recognize your name more. Because I've had a professor who I emailed her one time and she was like, I didn't recognize your name, and so I didn't see it right away. I didn't realize you were a student asking a question. I'm so sorry. It took her like a minute to get back. But then every time after that, she emailed me back like within like 15 minutes, even if it was like, I mean, don't email at 11 o'clock at night, but she emailed me back at midnight one time and it was like an emergency question. But yeah, so they're available for you, especially because they know that this is a hybrid program. So they know that they're not seeing you in person, and they make themselves available for you.
Yeah, can I ask a question?
Yeah, what's the question?
I'm from like 20 years of experience outside health. So like I work in business administration, consumer insights analytics, but I'm really thinking in changing in studying and being a nurse. So I think the program seems really good. So my question is about what are the tips you guys have, and probably you, right, that comes from the same background, for someone like me that comes from like huge experience in business, corporate America, and managing people, but in a different setup, right? What are the challenges and what are the things you should be thinking going through that process?
So correct me if I'm wrong, is the question for a career-changing student, what kind of challenges and tips do you have for making that long career change? Is that correct?
Yeah, especially connect to the program, right? Of course, the change you happen when I start working, but also like you stop working, at least for a moment, going back to study. I didn't study health in the past, so how does it look like? What you experience, because you accept people like me, right? Of like bachelor's degree. Yes.
So I think I'll probably see if Zach wants to answer this because he went through this, but I just want to let you know, before my husband convinced me to go back to nursing school, I did civil engineering, I did software quality analyst for a while, and then I was a real estate broker before, like most recently before becoming a nurse. I was like the top agent in Shore West selling condos downtown. It was super groovy. And then the crash happened in like 2008. And I'm like, I'm out. I need something more meaningful in my life than this. And so became a nurse coming from business backgrounds, basically. So it's absolutely doable with the right programs. So Zach.
Yeah, I previously to this was a regional operations manager for a real estate company, actually, out in Oregon. So I had, like I said, zero healthcare experience, and I've been out of school for an X amount of years that I'm not going to say. But I had to relearn how to study. Like, I realized I did not know how to study. I did not know how to learn anymore. I mean, obviously, I knew how to learn, but how to sit in a classroom, virtual classroom, how to read a textbook and glean the right information from it. It was hard. It was really hard. So I met with our academic success coach monthly or bi-monthly at first, and then I met with that tutor weekly to talk about, what I was struggling with, because I was like, part of this is I don't even understand medical terms. I don't even know what that word means. And I'm supposed to not just understand that word, but understand this concept and comprehend it. And especially in your pathophysiology class, which is in your first semester for most people, that is not a memorization class. That is a comprehension class. You need to understand the concepts and be able to apply them coming out the other end. Pharmacology, yeah, you need to understand it, but it's also kind of a memorization class. Can you memorize like what side effects go with each drug? So it was really hard going into that. And I come from a background too of I was in PR and hospitality and then business management. I didn't really have to have like deep comprehension of how something impacted this, which impacted this, which impacted this, which made your kidneys explode. So, it was very different. But use the resources that are at your disposal. Ask for the help, meet with the professors. That's the biggest one. Take as many notes as possible, and also just come with an open mind. If you go in there and you're like ready to learn and you're ready, that's what, when Haley was talking about what to do in clinical, go in with an open mind, be ready to be the person that will make a fool of yourself, because you're going to be wrong. Like especially if you come from a non-healthcare background, you're going to be wrong. I've been very wrong multiple times. Somebody asked me what kind of drug I was giving, and I said it was an antibiotic, and it was like an antihistamine or something. I don't remember. And they were like, why would you give them an antibiotic? And I was like, because they're having an allergic reaction. And they're like, that doesn't make any sense, So be ready to like be a fool too, because that's the best way to learn, to make the mistake and learn. As long as it's not hurting anybody, don't give the drug if you don't know what you're giving. Always know the drug before you give it. Yeah, does that answer your question? Yeah. Okay. Yeah, for sure.
And yeah, just for time purposes, we got a couple that just questions that came through. So I'm just going to power through these questions for you because I know you guys just asked them. So one question was basically asking, if you're an out-of-state student and you come to the program, can you be licensed back in your state, right? The answer is yes. So you're always welcome to take the NCLEX back in your home state, pass the NCLEX, become a certified registered nurse. But there's also the compact states. So a lot of states do, but I'll let Holly maybe answer this real quick.
Yeah. So one of the things that we tell you is, so part of what we very intentionally do here is we set up our prerequisites to maximize the probability that you will be eligible to get licensed in any state in the country. There are some states where they say, for example, and I think California is one of them, like you can be licensed there if you have like microbiology with a lab on your transcripts. Okay, well that tells you why there's a method to our madness with our prereqs. Now there are a few states that will say you have to have a separate clinical course, not just clinical experience, meaning simulation or being exposed to a concept, but you have to have distinct individual separate courses in mental health, where you actually go to a mental health facility for 6 or 12 weeks and do clinical, and pediatrics and OB. That aligns with a typical 4-year BSN type of program where you're likely to have those distinct separate courses. There are a few states out there like that. So we tell students it is important that you know what your state's requirements are if you're intending to go back and be licensed there. But for the most part, I do the licensure meetings with students, and I've looked into a lot of states, and we don't typically have a challenge or a problem with that. And you can be licensed in Wisconsin and get your license endorsed elsewhere too. So usually that's the solution and the pathway also.
Thank you for that. And you know, just speaking of terms of staying on time and stuff like that, we do got to start kind of wrapping. So I just want to make one announcement, especially for everyone who's on YouTube Live. Thank you for joining us. But if you have other questions, right, reach out to your admissions advisors. Technically, you guys all have admissions advisors. You guys have our number. Reach out to us. We can connect you to these people later on if you still have a bunch of questions. Because I know a bunch of questions just came through. Unfortunately, we can't get to them right now. I do truly apologize. Thank you for everyone who's here in person. I just want real quick, we always like to end it like this really nice way. If everyone could just go around and just do one last piece of advice. We have 3 minutes, 30 seconds apiece. Last piece of advice you'd give to a student thinking about joining the program. Ready, set, go.
Definitely reach out to your advisors, as Torrance said, and just keep in contact with us. Like, even if you are in out of state or you are here. Yeah. He said 30 seconds. But yeah, definitely keeping in contact and in touch with us. And also, like, again, us ambassadors, we're always here to help you out if you guys have any questions and want to talk to us after we're done.
Have an open mind. The last thing I'll say is I went into peds thinking I would never, ever, 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 ever go into peds, and now I kind of want to be a peds nurse. So I also still want to do CRNA. That's my long-term goal because, you know, that's where the money's at. But peds is like maybe second best. We'll see.
I will say this is a full-time program, so there's going to be times where you feel stressed or overwhelmed. It's okay to take time for self-care, I would say. So my advice is do whatever you need to do. Take a walk your dog, look at the sky, literally do anything to stress, touch some grass, just do whatever you can to help yourself and take care of yourselves at the end of the day.
Yeah, I think like when you're preparing to go into the program, those academic advisors and the admission advisors and all of those people are going to be reaching out to you a lot. So just like get those prereqs done, be ready to write those like admission essays, and like communicate a lot with the people here that are helping you get into the program. I think they reach out a lot. They were calling me a lot, which was good. I didn't mind it. But yeah, I think that was very helpful. So just make sure you're using the resources that you have.
1 minute.
Be flexible, be open. I like what they had to say. And you will be successful. We're here to support you.
Just do it. And so when I thought about doing this, yeah, well, you know, okay. But if you're hemming and hawing, a year from now, you could be like halfway done with the program or through your first or second semester. And you might, if you don't do it a year from now, you might be looking back saying, had I just gone forward, it would be completely different now. So yeah, just think about where you want to be 1 year or 2 years from now.
Thank you. And everyone, thank our panelists. They were amazing here today. Again, for everyone online, reach out to us, send us emails. You have our contact information. Thank you guys for joining us today, and I hope you guys will consider us for your nursing education. Good luck. Thank you.